patient dies during tattoo placement under general anesthesia. I knew it was inevitable. I just didn't think that it would occur this quickly. I'm going to be talking about the very unfortunate case of Ricardo Godoi, a 45-year-old social media influencer and entrepreneur who elected to have a very large tattoo placed on his back under general anesthesia. Unfortunately, shortly after induction and intubation, he had a full cardiac arrest and was unresuscitatable, despite a cardiologist being brought into the operating theater. And he was declared dead in the operating room before the tattoo artist even got to place one drop of ink in the skin. For me, a board-certified anesthesiologist, this highlights my belief that the risk of general anesthesia for a tattoo placement way outweighs the rewards of having it done. In this video, we're going to look at the potential things that happened here. According to his family, he had a medical evaluation and came in with a medical clearance to have this procedure done. Initially, it was going to be done in an outpatient facility. However, at the end, they decided to do it in a hospital setting in Santa Catarina, Brazil. He was brought to the operating room, placed on all the standards of monitoring equipment, and the induction of anesthesia begun. They said shortly after intubation, he went into full cardiac arrest. They tried to do a resuscitation, but it was unsuccessful. They called a cardiologist, and he couldn't assist him either. He was declared dead in the operating room before the tattoo artist even got to place one drop of ink in the dermis. So let's look at what could have happened. He's 45 years old, seemingly in good health. They're not going to do an extensive cardiac workup. They're not going to do a stress test on him. He doesn't have any symptoms of coronary artery disease, but he most likely does. So what could have caused this sudden cardiac arrest that was unresuscitatable? Well, there's a potential that he had undiagnosed coronary artery disease. It's possible that he had plaque occluding a major portion of a significant artery, such as the left coronary artery or the left anterior descending, which supplies blood and oxygen to a vast majority of the heart. And during the induction or just after the induction, either that piece of plaque broke off and occluded the artery, or maybe a piece of calcium broke off, again occluding the artery, leading to a massive myocardial infarction. In other words, the oxygen to the heart is cut off and the heart muscle dies very quickly. It's also known as a heart attack. That would make him unresuscitatable if it was such a large part of his heart. I find interesting, I don't know how they do it in Brazil, but anesthesiologists in the United States are trained to handle these catastrophic emergencies. We usually don't call cardiology into the operating theater. I found that unusual, but I'm practicing in the States. I don't know if in Brazil they routinely have cardiologists coming into the operating theater. Could he have thrown a blood clot? It's highly unlikely, because if he did have a deep vein thrombosis, he would have some pain. He wouldn't be asymptomatic most of the time, especially in a young person. So it's potential that he threw a blood clot and died of a large pulmonary embolism, but probably less likely than the cardiac event. Could he have had a cardiac arrhythmia secondary to anesthetics? Again, it's possible, but there's no documentation of any irregular heart rhythm during the induction or the initial intubation. What else could have happened? Well, that endotracheal tube might not have been in the trachea. If it's anywhere else, such as the esophagus, he's not going to get oxygen to the lungs. And over a few minutes, he's going to desaturate, his oxygen level is going to get low, and then he's going to have a cardiac arrest. That's a potential. But interesting, usually you would check for something like that, or you would listen for breath sounds before you even got started. Plus, if this was a standard operating theater, they would have something called capnography, which would measure CO2, And if that endotracheal tube was anywhere else but the trachea, there would be no CO2 coming back. So that theory is questionable. Now, they said it was going to be placed on his back. That meant he had to be put in the prone position, face down. When you are putting an unconscious patient under general anesthesia into the prone position, it's a very careful, coordinated effort to lift that patient up and turn them face down. They never mentioned in any of the documentation if they ever got that far. From what I read, it seemed like they did the induction, the intubation, and then moments later, full cardiac arrest. The hospital did an evaluation, and on their documentation, they listed the cause of death to be anesthesia, respiratory arrest, cardiac arrest, possibly attributable to the use of anabolic steroids. Now, the family was very upset with that anabolic steroids, which would be testosterone, because they said he hadn't been taking any for at least 5 months, and it was not really mentioned in his preoperative evaluation. Well, the hospital is right on a few points. He definitely had cardiac arrest. Respiratory arrest is a different thing. He was going to have respiratory arrest already because they induced general anesthesia. And usually, in the early phases of general anesthesia, you're not breathing. It's a potential that they put an endotracheal tube in and they were going to have him spontaneously breathe after the initial induction agents wore off. It's not really that practical. To have an endotracheal tube and have a patient spontaneously breathe is a lot of work. It's hard to breathe through that little tube. Plus, he'll probably be gagging. So my suspicion is he wasn't breathing at all, and they were going to take over his breathing, as done in a majority of the general anesthesia cases. Now, could the testosterone that he used 5 months ago done this? It can. Testosterone increases your risk of clotting because it changes the viscosity of the blood. It increases the rate of coronary artery disease. It can also accelerate coronary artery disease. So is it a potential that the testosterone from 5 months ago changed his coronaries? It definitely is. Is that what killed him? I'm not sure if it was related to his previous use of anabolic steroids. But in all likelihood, he had some coronary artery disease that led to this catastrophic event that was unresuscitatable. Unfortunately, this case highlights the risks of having general anesthesia. Even though we have excellent care, excellent monitoring, significant improvement of anesthetic agents, there's still always the risk that something untoward and unexpected could happen, and you might not recover from that. I'm going to ask in the comments section to just be kind. Remember, this was a healthy 45-year-old man with a family, somebody's son, somebody's brother. He wanted to have a tattoo placed, he just didn't want to have the pain of having it done. Never anticipated that it would cost him his life. So we have to be very kind with this. It's a horrible, unfortunate outcome. If you did enjoy this video, please give me a thumbs up, ring the bell, and hit subscribe so I can give you more future videos. Take care. Have a good day.